Electricity and Magnetism in Medicine. By Assistant Professor of Medical Physics, Dr. Al-Arif. The electrical activity of the heart. The electrocardiograms. Every action involving the body's muscles is initiated by electrical activity. The voltages produced by muscular action in the heart are particularly important to physicians. Voltage pulses cause the heart to beat, and the waves of electrical excitation that sweep across the heart associated with the heartbeat are conducted through the body via the body fluids. These voltage pulses are large enough to be detected by suitable monitoring equipment attached to the skin. The voltage pulses can be recorded on an instrument called an electrocardiograph, and the pattern recorded by this instrument is called an electrocardiogram, EKG. To understand the electrical activity of the heart, the right atrium of the heart contains a specialized set of muscle fibers called the SA, sinoatrial, node that initiates the heartbeat. See Figure 1. Electric impulses that originate in these fibers gradually spread from cell to cell throughout the right and left atrial muscles, causing them to contract. The pulse that passes through the muscle cells is often called a depolarization wave because of its effect on individual cells. Once the depolarization wave has passed through an individual heart muscle cell, the cell recovers the resting state charge distribution, positive out, negative in about 250 milliseconds. When the impulse reaches the atrioventricular AV node, see the figure. The muscles of the atria begin to relax, and the pulse is directed to the ventricular muscles by the AV node. The muscles of the ventricles contract as the depolarization wave spreads through the ventricles along a group of fibers called the Purkinje fibers. The ventricles then relax after the pulse has passed through. At this point, the SA node is again triggered and the cycle is repeated. A sketch of the electrical activity registered on an EKG for one beat of a normal heart is shown in Figure 2. The pulse indicated by P occurs just before the atria begin to contract. The QRS pulse occurs in the ventricles just before they contract, and the D pulse occurs when the cells in the ventricles begin to recover. Figure 2 shows normal electrocardiogram, EKG or ECG. The EKGs for an abnormal heart are shown in Figure 3. The QRS portion of the pattern is wider than normal, indicating that the patient may have an enlarged heart. Electrical signals from the nervous system. Specialized cells in the body called neurons form a complex network that receives, processes, and transmits information from one part of the body to another. The center of this network is located in the brain, which has the ability to store and analyze information. On the basis of this information, the nervous system controls parts of the body. The nervous system is highly complex and consists of about 1,010 interconnected neurons. The messages transmitted by neurons are voltage pulses called action potentials. When the pulses reach the end of the neuron, they activate either muscle cells or other neurons. Neurons can be divided into three classes: sensory neurons, motor neurons, and interneurons. The sensory neurons receive stimuli from sensory organs that monitor the external and internal environment of the body. The sensory neurons convey messages about factors such as light, temperature, pressure, muscle tension. The motor neurons carry messages that control the muscle cells. The messages are based on the information provided by the sensory neurons and by the brain. The interneurons transmit information from one neuron to another. Each neuron consists of a cell body to which are attached input ends called dendrites and a long tail called the axon, which transmits the signal away from the cell. See Figure 4. The far end of the axon branches into nerve endings that transmit the signal across small gaps to other neurons or to muscle cells. Electrical signals from the brain. Electrical signals are also important in the electroencephalograms (EEGs) of brain waves, as shown in Figure 5. In contrast to the very regular EKG patterns, the EEG signal is irregular, but it has identifiable rhythmic patterns: alpha waves, frequency of 8 to 13 Hz, beta waves, 14 to 25 Hz, theta waves, 4 to 7 Hz, delta waves, less than 3.5 Hz. Figure 5 shows schematic of changes in brain waves during different stages of wakeful magnetism in the body. One effect of magnetic fields on blood flow. Blood is a living tissue that circulates around our whole body via a network of arteries, veins and capillaries. It carries nutrients, oxygen, hormones, antibodies, heat, electrolytes and vitamins to the body's tissues. Blood contains red blood cells, white blood cells, platelets, plasma, electrolytes, hormones, minerals and iron. The blood is transported from the heart to the lungs where it picks up oxygen and then transports it to all the organs and tissues. Every part of the body depends on blood to provide the necessary oxygen and nutrients it needs to survive. Magnets are composed of metal alloys such as iron, nickel or cobalt. They will attract many different types of metallic particles. The blood contains iron, and when therapeutic magnets are placed on the skin, a magnetic field penetrates through the skin and into the surrounding tissues and blood stream. The iron in the blood is attracted to the magnetic field. This causes movement within the bloodstream, and the increased activity causes the blood flow to improve. The increase in blood flow is localized to the area where the magnets are placed. When magnets are placed over a major artery, there is a much larger perfusion of blood flow, so the magnetic field is carried further around the body. When the body's blood flow oxygen level is increased, nutrients and hormones are distributed to the organs and tissues much more effectively and quickly. Plus the tissues also gain oxygen, healing nutrients and hormones including endorphins, which are the body's natural pain-killing hormone. If there is an injury which is supplied with regular fresh oxygen, nutrients and endorphins, then the injury will heal much faster. 2. Effect of magnetic fields on cells. All cells in the body share common components, regardless of their type. One of the common constituents of all cells is ions. Ions are positively and negatively charged particles that conduct electromagnetic pulses from within the cell. The electromagnetic pulses allow the cell to function. In a normal healthy cell, the ions are distributed around the cell, with all of the positive ions on one side and the negative ions on the opposing side. The ions which live outside of the cell in the tissues will align with those inside of the cell so that opposing poles are together with the cell membrane between them. This allows fluid, oxygen and nutrients, fluid exchange, to move freely in and out of the cell, while maintaining the natural balance within the cell, homeostasis. In a diseased, injured cell, the positive and negative ions do not stay on opposing sides of the cell. They are disrupted and scatter randomly around the cell. At the same time, the ions on the outside of the cell membrane also become scattered as they try to find their opposing pole. This results in cellular imbalance. Extra fluid from the tissues outside the cell is able to penetrate the cell, which in turn pushes vital nutrients, hormones and electrolytes, salts, out of the cell. The cell's ability to function is greatly reduced in cellular degeneration and cell death. When a static magnetic field is applied over an injured area, the magnetism penetrates into the tissues and surrounds the damaged cell. The magnetic field that is created around the outside of the cell will pull the ions, both inside and outside, back into alignment. The result is that the ions once again return to their correct position within the cell. The extra fluid that has penetrated the cell is pushed out, via osmosis and diffusion, and returned to the surrounding tissues. The cell regains its natural healthy balance and any damage are repaired over a period of days. 3. Effect of magnetic fields on inflammations. Inflammation is the body's reaction to invasion by an infectious agent, antigen, or even just physical, chemical or traumatic damage. The inflammatory reaction is one of the body's oldest defense mechanisms. When damage occurs, the body's automatic defense system starts the inflammatory process within seconds. Blood flow is firstly increased at the point of injury. The blood vessels widen, vasodilation, to allow oxygen, clotting agents, platelets, and white blood cells to penetrate the damaged tissues. Over a period of hours, the concentration of white blood cells increases at the injury site. White blood cells fight infection. When static magnets are placed over an area of inflammation, the magnetic field penetrates through the skin and deep into the tissues and bloodstream. Damaged cells will react to the presence of a magnetic field by realigning their ions into the correct position. This begins the process of eliminating the excess fluid from within the cell. Cell damage will stop and healing of the cells will begin over a period of days. Magnetic fields will also affect the white blood cells that are surrounding the injury and fighting the disease. Magnetic fields will stabilize all of these processes and aid the body in its recovery.